I have been working in cancer control, cancer prevention in my country, in Zambia. Started off with the cervical cancer prevention program. And for the last 3 years, I've been working as a national coordinator for cancer prevention for the Ministry of Health. So the Zambian government just launched the first National Cancer Control Strategic Plan, which is prioritizing 4 cancers. That is cancer of the cervix, breast cancer, prostate cancer, and retinoblastoma, which is eye cancer in children. And this was arrived at because we looked at cancers with high burden, but we also look at cancers which have low costs but high impact interventions that we can do in these 5 years. What I have found out working from both angles is that most of the time, most global leaders or most organizations come into a country, they will simply have a one-off meeting with the Minister of Finance or the Minister of Health. We involve the high-level leaders, but don't involve so much the people who are working as technocrats in those countries. And by this, I mean that you will have the Minister of Health, the Minister of Finance, who are the key political leaders in a ministry who are given the vision and the agenda. But it is also important that the people who work with them, they've got the permanent secretaries, they've got directors, they've got program officers, who are equally important to understand this agenda. It is the role of the team at the Ministry of Health to also facilitate or help the people at the Ministry of Finance understand what the benefits are in investing in cancer. It is also that the different programs that are being broached to a country are also in line with what those countries see as priorities. And I think it's about time that when you're having these discussions as global leaders at national level, that the team that works around these political leaders is equally informed. If they don't have a strategic plan or they don't have their priorities, it is important that people from the global level are able to work through with them to come up with a plan and let them decide what is really important for that country. It's also about mutually beneficial kind of partnerships. In the long term, we should have oncologists that are trained, that are Zambian bred, that will be able to sustain this program. In the meantime, we can have an exchange program where we're having somebody coming in, but we shouldn't make that the mainstay. The lifetime of that project is 5 years, and once it's gone, there's no one who can take over from what was happening. So sustainable programs with local people involved, involving the different ministries, and the people on the ground will know who actually moves these decisions and who the ministers talk to when they need to make a decision. Those are the people that are usually missing in the picture. We talk to the top, but the bottom has no idea what we discussed.